you. Mr. Miller.
Thank you, Mr. Chairman. And thank you to the witnesses today. We're here to ensure that organ procurement organizations uphold the highest standards in both their life-saving mission and their responsibilities as nonprofit entities. There are 55 OPOs, each mandated by federal law to perform procurement efforts in their donation service area as certified by Centers for Medicare and Medicaid Services. In 2024, there were more than 48,000 organ transplants performed, continuing a record-setting trend and representing a more than 55% increase in organ transplants in the last 10 years. In my home state of Ohio, LifeBank is one of the original 7 OPOs ever founded, with a service area covering 4 million people and working with 80 hospitals, including many in the Cleveland region. Maintaining the highest standards of integrity is paramount in organ procurement, chiefly to foster trust and to save lives, but also to safeguard valuable taxpayer resources for these critical purposes. For this reason, I'm concerned about reports that certain OPOs may be involved in alleged fraudulent schemes and improper actions related to their unique position as tax-exempt entities. As many OPOs strive to maintain and lift the integrity and standards of care at these life-saving missions, some challenges I have heard from my home state of Ohio include changes to the conditions for coverage that will affect the 2026 recertification process, such as evaluation of only one of the 4 years as part of the 4-year cycle, which may not account for process improvement efforts or overall performance. Concerns that the transplant rate metric reflects transplant centers' acceptance of organ offers rather than OPO performance, yet still heavily influences on OPO's ranking and chances for recertification. For example, data reveals a 29% kidney non-use rate per organ recovered per transplant. Evaluations may not account for geographical health, disparities, and environmental impacts. For example, diabetes is at a higher prevalence in Northeast Ohio, resulting in challenges in the donor pool and organ eligibility. Ms. Erickson, as you know, OPOs are certified by CMS to ensure the quality and safety of donated organs, including adherence to legal and regulatory requirements and to identify improvement opportunities. Unfortunately, we've been made aware of potential fraudulent mechanisms or manipulations of the system that could compromise integrity. Please describe the type of improper schemes that you may be aware of in the industry, as well as your thoughts on how to combat them, and would remedies like requiring transparency of the Medicare cost reports submitted by OPOs shed light on the issues of overbilling and unallowable cost?
Sir, they would. One of the most disturbing practices that happens at many OPOs is harvesting kidneys that will never be used in transplant. In fact, one industry insider gave a presentation to other OPOs about how they could differentiate between a financial count for kidneys and a clinical count for kidneys. That is another way of saying how to commit Medicare fraud. In fact, one whistleblower shared with Congress from Network for Hope that when their freezers were too full of kidneys that they could not use, they would take them to the University of Louisville Jewish Hospital and incinerate them. Part of the kidney harvesting problem is a problem of lying to families about consent and the fact that CMS will pay OPOs whether those kidneys are ever transplanted or not. This has to end.
I completely agree, and it's abhorrent, and thank you. Another question, Ms. Erickson. I understand there may be other practices that do not increase Medicare reimbursement but may assist the OPO in certification metrics reported to CMS. Can you describe what other actions may be occurring to improperly boost metrics that may not be readily available through Medicare cost reports?
Absolutely, sir. As your colleague, Congressman Bean, said, there is also the massive harvesting of human pancreata that do not go to help any patients either through transplant or research. This has happened to 7,000 American families who have been lied to, including in your home state of Ohio. CMS has said it will close this loophole, but it has not done so. And not doing that leaves every American family at risk not only of being lied to about how their loved one's very body parts will be used, but also it could keep dangerous OPOs in place by falsely inflating their performance.
Thank you very much for your testimony and all the witnesses. Mr. Chairman, I have one more question I'll submit for the record. I yield back.